What if I told you that a small, inexpensive pill sitting in your medicine cabinet could save your life? Sounds unbelievable, right? But it's true. Aspirin isn't just for headaches, it's a pain reliever, a heart attack and stroke preventer, and even a potential cancer fighter. But how does it work? And is it safe for everyone? By the end of this video, you'll understand the science behind aspirin, its benefits, risks, and whether you should be taking it. Let's dive in. Aspirin, or acetylsalicylic acid, is a widely used medication that belongs to the NSAID Non-Steroidal Anti-Inflammatory Drug family. But unlike other NSAIDs like Ibuprofen or naproxen, aspirin has some unique properties. How does aspirin work? Aspirin works by blocking an enzyme called Cyclooxygenase, COX, which comes in two forms. COX-1 helps produce thromboxane A2, which makes platelets sticky and protects the stomach lining. COX-2 produces prostaglandins that cause pain, fever, and inflammation. Aspirin is a non-selective COX inhibitor, meaning it irreversibly inhibits both COX-1 and COX-2, but it has a higher affinity for COX-1. What does this mean? Blocking COX-1 prevents blood clot formation, which is great for heart health, but it also weakens the stomach lining, increasing the risk of ulcers and bleeding. Blocking COX-2 reduces pain, fever, and inflammation. Do you understand? Okay, next, here's what makes aspirin special. Most NSAIDs reversibly inhibit COX, meaning their effects wear off when the drug leaves your system. But aspirin irreversibly inhibits COX. How long does this effect last? Since aspirin permanently disables platelets from making thromboxane A2, its blood thinning effect lasts for the entire lifespan of a platelet, about 7 to 10 days. Okay, I have a question for you. Why do doctors tell patients to stop aspirin before surgery? If you leave a comment on the answer to this, you now have good knowledge about aspirin. Now, let's talk about the most common reason people take aspirin: pain relief. Fever and pain relief. Aspirin reduces headaches, muscle pain, toothaches, menstrual cramps, and fever. Arthritis and inflammation. It's commonly used for rheumatoid arthritis and osteoarthritis because of its anti-inflammatory properties. Did you know? Before aspirin was invented, people used willow bark, which contains natural salicylic acid, for pain relief. Nature had the answer all along. Aspirin for heart attacks and strokes. Here's where aspirin is a lifesaver, preventing heart attacks and strokes. How does this work? Heart attacks and strokes occur when blood clots block arteries. Normally, platelets clump together to stop bleeding, but when this happens inside blood vessels, it can cause deadly blockages. Aspirin as a blood thinner? Aspirin prevents platelets from sticking together by blocking thromboxane A2 production. This reduces clot formation, lowering the risk of heart attacks and strokes. Can aspirin stop a heart attack? Yes, if someone is having a heart attack, doctors often recommend chewing an aspirin, not swallowing whole, to quickly thin the blood. But remember, always call 911 first. Never take aspirin for heart health without a doctor's approval. Aspirin and cancer prevention? Now, let's talk about something still being researched: aspirin and cancer prevention. Studies suggest that aspirin may reduce the risk of colorectal cancer and possibly other cancers. Why? Because inflammation plays a role in cancer development, and aspirin's anti-inflammatory properties may help slow down cancerous cell growth. But hold on, this doesn't mean aspirin is a magic cancer pill. More research is needed, and taking aspirin daily for cancer prevention should only be done under medical supervision. Who should and shouldn't take aspirin? Aspirin isn't for everyone. It can cause serious side effects. So let's break down who should and shouldn't take it. Who may benefit from daily aspirin? People with a history of heart attacks or strokes. People with high heart disease risk, diabetes, high blood pressure, etc. Some patients with colorectal cancer risk, only if a doctor recommends it. Who should avoid daily aspirin? People with stomach ulcers or a history of gastrointestinal bleeding. People taking blood thinners like warfarin. Children under 16, risk of Reye's syndrome. People with aspirin allergies. So there you have it. Aspirin isn't just a painkiller, it's a heart protector and maybe even a cancer fighter. But it's not for everyone, and long-term use should only be under a doctor's guidance. What do you think? Have you or someone you know taken daily aspirin? Let me know in the comments below. If you found this video helpful, hit that like button, subscribe, and turn on notifications so you never miss out on more medical insights. Stay curious, stay healthy, and I'll see you in the next one.